I'll just give you a story of a patient with autoimmune disease that I had recently. She came into Cleveland Clinic. She'd been seeing all the top doctors there, and she had a whole list of problems. That's why I call myself a holistic doctor, because people have a whole list of problems, right? You know those people.
Yes.
and this woman came in, and she had psoriatic arthritis, which is her main complaint, and she still, had terrible joint pain and a rash, a psoriatic rash all over her body. And she was on a very powerful drug, a TNF-alpha blocker, which costs about $30,000 a year. She still wasn't better. She was a little better so she could function, but she was not better.
Yes.
She also had a whole bunch of other stuff. She had irritable bowel, she had reflux, she had migraines, she had depression, she had prediabetes, she was overweight, she has postnasal drip, and she had itching everywhere.
Yes.
Ear itching, scalp itching, anal itching, vaginal itching. She had a spectrum of disorders that all have very common roots, even though they show up in different parts of the body. And if you look at autoimmunity, it affects 80 million people in this country. When you lump them all together, from Hashimoto's thyroid disease to MS to inflammatory bowel disease to rheumatoid arthritis to psoriatic arthritis, and the whole spectrum of disorders are seen often as very separate things. But we now know that autoimmunity has common roots, that it's the body attacking itself, and that there's a reason for it. And unfortunately, most common therapies are designed to suppress or block the body's own immune system instead of figuring out why it's so. So there are really only three main triggers for autoimmune disease, with a couple of add-ons, right? Diet and stress always influence every disease,
Yes.
right? But the main three triggers are allergens, microbes, and toxins. And as functional medicine practitioners, our expertise is being able to drill down into each of these areas and discover in any particular person what's driving that problem. So you can have 10 people with a particular autoimmune disease like rheumatoid arthritis, which have 10 different causes. The second category are microbes. And these are the second big driver, which is not just external microbes, but the 3 pounds of bacteria that live in your intestine. There's a lot of things that disrupt our gut microbiome, right? There's our increasing rate of C-sections, breastfeeding, changes in our food supply, low fiber, high sugar, GMO-made foods may alter our gut microbiome. The overuse of gut-busting drugs like antibiotics, anti-inflammatories, antacid drugs, hormones, steroids, all these drugs alter our gut microbiome in ways that lead to lack of breastfeeding, C-sections. All these things drive imbalances in our biology. And so when you end up disturbing the gut microbiome, it can also lead to a leaky gut. It can also upregulate inflammation in the body. So dealing with an anti-inflammatory diet and a hypoallergenic diet and optimizing the gut flora through the functional medicine approach of the 5. For example, I was giving a talk at Cleveland Clinic recently, and this man came up and he says, I did your 10-day detox diet book, and in 10 days my rheumatoid arthritis symptoms went away. Is that possible? I'm like, yes, it's possible. If it's something you're eating and you go on an elimination diet, an anti-inflammatory diet, and a low glycemic diet, yes, your body. You said, how can people get started, right?
Yes.
And so I think the easiest thing for people to do is to change the things that they have control over, right? So their diet. And most people have never tried an elimination diet, right? I don't even like to call it an elimination diet. It's really an addition diet.
Yes.
What are all the great foods you're adding to your diet that are healing? You're taking out the bad stuff, but you're putting in all this good stuff.
That's so great. I feel the same way.
So it should be called an addition diet. It's really about looking at things you can do. So that's why I wrote the 10-day detox diet, which is great for sugar addiction, but it's also a powerful anti-inflammatory autoimmune diet. And she came back 2 months later. I said, guess what? I've stopped all my medications. My psoriasis is gone, my arthritis is gone, I have no more reflux, no more irritable bowel, my headaches are gone, my sinuses are clear, and I lost 20 pounds without trying, and I'm never hungry. And I feel amazing, I'm not tired, and I can sleep. All these things that were so difficult to treat when you were treating all the symptoms, when you treated the cause, they all went away as a side effect of getting healthy. So many people. I saw another little girl who was 10 years old, Isabel, and she came in with mixed connective tissue disease. And she was a sick little 10-year-old. She had dermatomyositis, meaning she had rashes all over her body. She had muscle damage with elevated muscle enzymes. She had liver damage and inflammation. Her white blood cells and red cells were damaged and they were low. She had reflux and all sorts of gut issues. So every part of her body was completely affected by this condition. And her autoantibodies. 2 months later, she comes back and dramatic improvement. Her numbers started coming down. Her inflammation started coming down. A year later, and I found out she had mercury. By the time I got her test back, she had some mercury, and we had to detoxify her from mercury. And a year later, she was off all her medications. She had no symptoms, and all her autoantibodies had normalized, which is not something we ever see in conventional rheumatology.
Yes.
Right? We never see things reversed. We control them.
Yes.
We have chronic disease management. I don't want to manage a chronic disease. I want to get rid of it.
Right.
Stuff doesn't happen overnight. It's not like you wake up one day and you have rheumatoid arthritis or MS. These things have been smoldering. Many people go to the doctor and they go, what's wrong? I'm like, I don't know. Your tests are normal. You don't meet any criteria for an autoimmune disease, so come back later. If the only intervention you have is a hammer, everything looks like a nail, right? So if all you can do is give strong medications, you're not going to give those until someone's really sick. But if you have a set of interventions that can reverse autoimmune disease, you can start anywhere along that spectrum. So when someone comes in and they have elevated antibodies, I'm like, this is not normal. This is
not normal for you. This is not normal for anyone.
You should not be attacking yourself.
Yes.
I don't care what level of antibody it is.
Yes.
I don't care if you don't have any symptoms. Something is not right.